Lumbar canal stenosis. It refers to narrowing of the spinal canal, that is, compression of the spinal cord. Classification of lumbar canal stenosis, you can remember the mnemonic GLASS. GLAS. There is no double S, only a single S. So G for generalized, L for localized, A for anatomical. It can either be cervical, thoracic or lumbar, and S for segmental. Now let's talk about the cause of lumbar canal stenosis: kyphosis, scoliosis, fracture, degeneration, spondylosis. Clinical features of lumbar canal stenosis: males are more prone as compared to females. It is usually seen in people who are more than 50 years of age. Other features are low back pain, cauda equina syndrome. Here, the patient complains of pain in the buttocks and in the legs after walking, but it relieves on rest and forward bending. And the other feature is paresthesia, which means altered sensations. Let's talk about the special test. First, we have the stoop test. Ask the patient to walk briskly. Patient complains of pain, but the patient continues to walk. If the patient assumes a stoop posture, then the symptoms disappear. Then the stoop test is said to be positive. That is, from a straight position, the patient moves into a stoop posture. Pain decreases on forward bending because the canal length increases by 2.2 millimeter. Secondly, we have the walking test. That is, the patient walks on a leveled surface, firstly in an upright position, secondly in a flexed position. If the patient walks more, that is, if the patient covers a majority distance in the flexed position, the walking test is said to be positive. And thirdly, we have the static bicycle test. It includes the same procedure. First, the patient is in an upright sitting position. Secondly, the patient is in a flexed position. That is the static bicycle test. Investigations includes X-ray. It shows decreased diameter of the vertebrae. Treatment: conservative management includes drugs, for example NSAIDs, which is non-steroidal anti-inflammatory drugs, epidural steroids, physiotherapy, which includes HIIT, that is thermotherapy, exercises like swimming and flexion-oriented exercises, belts and corsets. Secondly, surgical management includes laminotomy, laminectomy, decompression surgery, foraminotomy. Normally, the diameter is more than 13 millimeter. In relative stenosis, it is usually 10 to 13 millimeter, and in absolute stenosis, it is less than 10 millimeter. This is a point to remember, that is normally the diameter of the lumbar canal is more than 13 millimeter, and as the lumbar canal undergoes stenosis, the diameter keeps on decreasing.